With more coronavirus coverage with a focus on COVID-19 in schools. We receive dozens of emails each week from parents who are concerned about the virus in their child's school.
So tonight we are getting insight from doctors. Channel 2's Brandon Walker live in the Texas Med Center with information that parents really need to hear. Brandon?
And Dominique, we'll start with Dr. David Callender, president and CEO of Memorial Hermann Health System. And he says that his team has met with superintendents from throughout the area through the Greater Houston Partnership. They've laid out their plans, and he says from what he's seen, schools do have a protocol in place. And he says, yes, schools are safe. But he also says that part of that comes a responsibility on our parts to make sure that we're doing what we're supposed to do outside the classroom to prevent spread inside.
We know that those measures work.
The COVID-19 basics, says Dr. David Callender, president and CEO of Memorial Hermann Health System. In school, wearing masks, keeping distance, cleaning, he says, has worked to control spread.
What they're telling us is they're not seeing the transmission of the virus within schools. When children are infected, they're coming to school with the virus.
Yet, when it comes to school and COVID-19, what's also important, doctors say, is contact tracing. That hasn't been easy in the Houston area, let alone Houston area schools, says Dr. Jeffrey Stark, professor of pediatrics and infectious diseases at Baylor College of Medicine.
Since we know that some of these infections are asymptomatic, we certainly may have transmission that's occurring from people who don't know they have it, especially if they've been recently exposed.
I think schools are trying really hard.
Dr. Wesley Long, a clinical pathologist at Houston Methodist Hospital, says that question of classroom safety is equally dependent on steps being taken in the community to control spread.
Well, to really get that close contact that most transmission is associated with, that sort of contact is much more likely to happen in a household or in sort of someone's daily life than it is to necessarily happen in a school environment.
Dr. Wesley Long also adds that it is important to pay attention to potentially asymptomatic students, and with testing being low in schools, that's something to be mindful of. But overall, with the protocols in place, he says that things are looking good so long as we handle our business. With that, with local cases rising, he underscores the fact that it is important to be vigilant. We're live in the Texas Medical Center tonight. I'm Brandon Walker, KPRC Channel 2 News.